Welcome to the third lesson on my channel, and today we're going to be talking about the direct and indirect pathways of the basal ganglia, which I think it's a topic that does need review. So let's begin. So in the basal ganglia, you actually have two signaling pathways, which are called direct pathway, and this one encourages movement. And you have the indirect pathway where you think about the IN in indirect, meaning inhibits movement. How does this work in actual diseases? In Huntington's disease, you have the medium spiny neurons of the indirect pathway being affected early on in the disease, allowing the direct pathway to predominate, and as that encourages movement, you develop chorea. In later stages of the disease, there is actually a Parkinsonian-looking clinical picture where the direct pathway is affected as well, and that leads to dystonia, bradykinesia, and rigidity. This is clinically visible in up to a third of patients with Huntington's disease, but this is not typically discussed in medical school textbooks or even any exams that I've seen. And it can be quite a surprise to you to see a late Huntington's disease patient that's actually exhibiting these findings. So if you're in an educational setting or taking any kind of exam, you would most likely be thinking about the degeneration of the indirect pathway and the classic chorea in Huntington's disease for the classic subtypes, unless you're dealing with the Westphal variant, the young onset Huntington's, which has dystonia and bradykinesia from the beginning. All right, so let's talk about the indirect pathway. So you have the cortex, which is excitatory, lands in the striatum, and the striatum itself is inhibiting globus pallidus, the external part, or globus pallidus externa. The negative or inhibition from the GPE inhibits the subthalamic nucleus, which is actually excitatory, and so that in turn affects the globus pallidus interna. The GPI then acts on the VA and VLA of the thalamus, and as you remember in lesson 2 about the thalamus, both the VA and the anterior part of a ventrolateral thalamus, so ventroanterior and ventrolateral anterior, are the basal ganglia linked portions of the thalamus. So what's an easy way to think about this? So if you have, as if you were multiplying numbers together, so if you have -1 times -1 times -1, you'll end up with 3 negatives. It's still a negative. So overall, the 3 negatives give you an inhibitory pathway. If we compare that to the direct pathway, which is much easier, you basically have 2 negatives make a positive, and that is excitatory, and these are will basically encourage movement by excitation of the VA and VLA of the thalamus, which then again has projections which are going to excite the cortex. In addition, there are fibers from the striatum that inhibit the substantia nigra, and these inhibit the substantia nigra pars reticulata inhibition of the thalamus. So basically, you're also disinhibiting the thalamus by this other pathway. Let's go forward. So what happens in Parkinson's disease? So you have the striatonigral pathway, which comes from the substantia nigra pars compacta, and it projects to the striatum. And at baseline, this pathway excites the direct pathway in the striatum by binding to the D1 receptors on the direct pathway, which are excitatory, and it inhibits the indirect or D2 pathway because the D2 receptors are inhibitory receptors. So in Parkinson's disease, when the striatonigral pathway is affected, and obviously the neurons of the substantia nigra degenerate at a more accelerated pace, so there's less activation of the prokinetic direct pathway, and there's less inhibition of the hypokinetic or inhibitory indirect pathway. So via both of these mechanisms, you're actually ending up with a hypokinetic picture. And again, contrast that to what's happening in Huntington's disease, where you're basically damaging initially the indirect pathway and causing more movements. All right, so that's all for tonight. Thank you very much for tuning in. If you're enjoying these reviews, please give me some likes and also click the subscribe button. All right, thank you.